Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Glipizide, Glyburide, Glimepiride. You have probably seen these names on your pill bottles or heard your doctor mention them. They belong to a class of medications called sulfonylureas, and for decades, they were some of the most commonly prescribed drugs for type 2 diabetes. But here's the thing, these medications have fallen out of favor in recent years. Newer drugs often work better, cause fewer side effects, and come with additional benefits. So if you are still taking one of these medications, you might be wondering, do I actually need this? Are there better options? And if your doctor wants to prescribe one, should you ask about alternatives? In this video, we are going to break down how sulfonylureas work, their benefits, their significant downsides, and whether they still have a role in modern diabetes treatment. Segment 1. What are sulfonylureas? Sulfonylureas have been around since the 1950s, making them some of the oldest diabetes medications still widely used today. The first generation is rarely prescribed anymore, but second-generation drugs like Glipizide, Glyburide, and Glimepiride remain common. Here is how they work. Sulfonylureas stimulate the beta cells in your pancreas to release more insulin. They do this by binding to a specific receptor that essentially tells the pancreas to push more insulin into the bloodstream. That may sound simple, but it is actually very effective. For many people, sulfonylureas can lower A1C by roughly 1 to 2 percentage points, which is comparable to some newer medications and similar to what Metformin can achieve. In fact, part of the reason these drugs became so popular is because they work quickly. Many people see meaningful improvements in blood sugar within days or weeks of starting treatment. But there is an important catch. Unlike your body's natural insulin response, sulfonylureas do not always pay close attention to how much glucose is actually in your bloodstream. They stimulate insulin release even when blood sugar is already near normal. And that design creates the two major drawbacks that have followed this drug class for decades: low blood sugar and weight gain. That does not mean sulfonylureas are bad drugs. They have helped millions of people manage diabetes successfully. But it does mean they come with trade-offs that are important to understand. Segment 2. The two biggest problems. Let us start with weight gain. Insulin is often described as a storage hormone. One of its jobs is helping your body store energy. Since sulfonylureas increase insulin levels, many people gain weight while taking them. The amount varies from person to person, but gaining several pounds is common. That matters because many people with type 2 diabetes are already dealing with insulin resistance. Additional weight can make that underlying problem worse over time. The second issue is more serious: hypoglycemia, or low blood sugar. Because sulfonylureas can continue stimulating insulin release even when glucose levels are falling, blood sugar can sometimes drop too low. Symptoms may include shakiness, sweating, confusion, dizziness, hunger, blurred vision, or a racing heartbeat. In severe cases, hypoglycemia can become a medical emergency. Not all sulfonylureas carry the same risk. Glyburide is generally considered the most likely to cause low blood sugar and is often avoided in older adults. Glipizide is typically considered safer, particularly for people with reduced kidney function. This is one reason many diabetes specialists have moved away from sulfonylureas when other options are available. Lowering blood sugar is important, but lowering it too much can create a whole different set of problems. Segment 3. Who should be especially careful? Older adults are at the top of the list. A severe low blood sugar event can increase the risk of falls, injuries, confusion, and even hospitalization. People with kidney disease also need to be careful because some sulfonylureas remain in the body longer when kidney function declines. That can increase the risk of prolonged hypoglycemia. Shift workers can face challenges as well. These medications were designed around fairly predictable eating schedules. If meals are delayed or skipped because of an irregular work schedule, the risk of low blood sugar may increase. And if you are someone who frequently forgets meals, follows a very low carbohydrate diet, or exercises intensely without adjusting your routine, sulfonylureas require a little extra attention. None of this means the drugs cannot be used safely. It simply means that matching the medication to the patient matters. Segment 4. How they compare to newer medications. Let us start with GLP-1-based therapies, such as Ozempic and the dual GIP/GLP-1 medication, Mounjaro. These drugs lower blood sugar while also helping many people lose weight. Several have demonstrated cardiovascular benefits, and some provide kidney protection as well. Importantly, they carry a much lower risk of hypoglycemia when used without insulin. SGLT2 inhibitors such as Jardiance and Farxiga offer a different set of advantages. They help the kidneys remove excess glucose through the urine and have been shown to reduce the risk of heart failure and slow the progression of chronic kidney disease in many patients. Even DPP-4 inhibitors like Januvia, while generally less powerful than GLP-1s and SGLT2 inhibitors, are weight neutral and have a very low risk of causing hypoglycemia. A major comparative effectiveness study published in 2023 found that several newer medication classes maintained blood sugar control more effectively than sulfonylureas when added to metformin. So why are sulfonylureas still around? The answer is simple: cost. Most sulfonylureas are available as inexpensive generics and can cost only a fraction of what newer medications cost. For many patients, especially those without robust insurance coverage, affordability remains a powerful advantage. Segment 5. Do sulfonylureas still have a role? So do these medications still have a place in modern diabetes care? Absolutely. The discussion is not really about whether sulfonylureas work. They clearly do. Glipizide, Glyburide, and Glimepiride remain effective medications that can significantly lower blood sugar, and their low cost and widespread availability continue to make them an important option for many people. The real question is whether they are the best choice for a particular patient. For someone who needs an affordable medication that reliably lowers blood sugar, a sulfonylurea may still be a very reasonable option. But for someone who is concerned about side effects such as weight gain and hypoglycemia, newer medications may be a better choice. And unlike several newer diabetes medications, sulfonylureas generally do not provide additional benefits for heart health, kidney protection, or weight loss. These broader considerations are one reason diabetes treatment has changed so much over the last decade. Doctors are increasingly choosing medications based not only on blood sugar numbers, but also on cardiovascular risk, kidney health, weight management, lifestyle factors, and overall quality of life. If you are taking a sulfonylurea and doing well, there may be no urgent reason to switch. But it is worth asking whether your current medication still aligns with your long-term health goals, and whether another option might offer advantages that are meaningful for you. Medications help, but they do not tell you what to eat or how to build better habits around food. That is why we created the Mindful Eating for Diabetes Guide. It is a free, practical toolkit to help you build a healthier relationship with food, with no extreme diets and no complicated rules. Just use the QR code on screen or the link in the description below. Segment 6. Final thoughts. At the beginning of this video, we asked a simple question. If you are taking Glipizide, Glyburide, or Glimepiride, do you actually need it? For some people, these medications remain an excellent choice. They are effective, affordable, and have helped millions of people manage type 2 diabetes successfully for decades. For others, newer medications may be a better fit because they can help with weight loss, reduce the risk of low blood sugar, and provide additional benefits for the heart and kidneys. So if you are taking a sulfonylurea, do not assume you need to stop it, but do make sure you understand why you are taking it, what benefits it provides, and whether it is still the right fit for you today. Now we want to hear from you. Have you taken Glipizide, Glyburide, or Glimepiride? Did you experience weight gain or low blood sugar? Comment below and please share this video with someone who needs it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.